Now at 5:30, caregivers are being showered with gratitude for National Nurses Week. Here in Kentucky, nurses themselves are celebrating some new legislation protecting healthcare professionals from unintentional medical errors.
But there are still other legalities they are not shielded from. Jose Alonso caught up with the Kentucky Nurses Association today, talking about House Bill 159.
Another busy day at the hospital. Nurses walking the hallways, assisting patients, and dealing with the stresses of the job.
We don't want it to be punitive. We want to make sure that people understand that we are human, that we make mistakes.
Nikki Wright with the Kentucky Nurses Association says right now, healthcare providers could face criminal charges if they make an unintentional medical mistake.
As nurses, we know that when we give patients medications, even if I was to take a medication, I don't know if I'm allergic to it unless I take it.
That's where House Bill 159 comes in, passed by state lawmakers and signed by Governor Beshear in March.
People make mistakes, and our nurses, they try really hard, and if they make a mistake and they hurt somebody, yes, you should be able to sue them, but not put them in jail.
This legislation doesn't fully protect nurses from certain things. What is that?
Say, for instance, as a nurse, that I intentionally done something to a patient, gave them too much medicine, then I'm not protected. Because once there's been a thorough investigation and it's proven that I maliciously did something, then of course that House bill is not going to protect me, because then I intentionally done harm.
It also doesn't shield them from civil suits. Families can still take a healthcare worker to court.
They should not have to go to jail for their mistakes. And there are some intense prosecutors that are trying to do that in other parts of the country, not in Kentucky.
KNA says this legislation is the first of its kind across the nation.
This is an issue where we will be the leader, and hopefully many other states will do this.
And that's why it was so important that it's done here in Kentucky, because we always want to be the ones out there at the front doing things that are not common within other organizations, other state organizations.
Ensuring medical workers like Nikki have one less thing to stress about at work. In Louisville, Jose Alonso, WHAS 11 on your side.
And House Bill 159 will officially go into effect coming up in June.